Did you know that prostate cancer is a significant health concern for men? It's actually the second most common cancer in men, right after skin cancer. Think about this. About 1 in every 8 men will be diagnosed with prostate cancer at some point in their lives. In the United States alone, it's estimated that around 300,000 men will receive a new diagnosis of prostate cancer this year, and tragically, over 30,000 men may lose their lives to it. These numbers are serious, but there's a very important piece of good news. If prostate cancer is caught and treated early, it's far less likely to be fatal. That's why recognizing the early warning signs is so crucial. Your awareness can truly be a lifesaver. Welcome. Today, we're going to talk about a vital topic, the early signs and symptoms of prostate cancer that men should absolutely not ignore. Many men don't give much thought to their prostate gland until it starts causing problems. This small gland, located just below the bladder, plays a key role in producing seminal fluid. Most prostate cancers are a type called adenocarcinomas, which means they develop from the gland cells. These cancers can be fast-growing, spreading quickly, or slow-growing, sometimes remaining undetected for years. While some slow-growing cancers might not cause symptoms for a long time, the risk becomes much greater if the disease spreads. So, understanding what to look out for is incredibly important. We'll be discussing 7 key early signs. Remember, even if you feel fine, regular checkups with your healthcare professional are essential. Let's explore these signs. Sign number 1. Painful or burning urination. Do you ever feel a burning sensation or pain when you urinate? This is a symptom to pay attention to. As the prostate gland enlarges, perhaps due to cancer, it can press on and obstruct the urethra, which is the tube urine flows through. This blockage can lead to discomfort or that burning feeling during urination. Sometimes, the cancer can also affect nearby areas like the bladder or rectum, causing pain. It's also possible for infections to occur if urine is retained, and these infections can also cause a burning sensation. While antibiotics might offer temporary relief for an infection, if the underlying cause is related to the prostate, that needs to be addressed by a doctor. Certain risk factors like a family history of prostate cancer, genetic predispositions, obesity, or lifestyle choices might also influence these symptoms. Sign number 2. Frequent urination, especially at night, nocturia. Are you finding yourself waking up multiple times during the night needing to use the bathroom? This frequent nighttime urination, known as nocturia, can be a significant red flag. When your sleep is constantly interrupted by these bathroom trips, it can leave you feeling exhausted and affect your quality of life. If you're annoyed or concerned by how often you're getting up at night to urinate, it's a good idea to talk to your doctor. Sometimes, keeping a simple bladder diary, just noting down when and how much you urinate, can help you and your doctor understand the seriousness of the issue. Sign number 3. Blood in your urine. Have you noticed any blood in your urine? This condition is medically termed hematuria, and it often appears in more advanced stages of prostate cancer, but it's crucial to be aware of. There are 2 ways this can present. Microscopic hematuria is when blood is present but only visible under a microscope during a urine test. Macroscopic hematuria is when the blood is visible to the naked eye, perhaps making your urine look red, pinkish, or even brownish. It's estimated that about 3 to 5% of men with prostate cancer might visibly see blood in their urine. This can happen if the cancer starts to invade parts of the urinary system, such as the kidneys, ureters, or the bladder itself. If you ever see blood in your urine, or if routine tests detect it, a thorough examination by a doctor is essential for early detection and diagnosis. Sign number 4. Persistent pain in your back, hips, or legs. Are you experiencing a nagging, persistent pain in your lower back, hips, or down into your legs? This is another symptom that shouldn't be dismissed. Prostate cancer, especially if it has started to spread, can unfortunately reach the bones. When this happens, it can cause a deep, aching pain in these specific areas. Research has actually shown that men who present with unexplained back pain have a higher likelihood of eventually being diagnosed with prostate cancer. In more advanced cases, this spread to the bones might also lead to weakness or even numbness in your limbs. So, if you're dealing with ongoing pain in your lower back, hips, or legs that doesn't have a clear cause, please see your doctor promptly. Sign number 5. Sudden and unexplained weight loss. Have you noticed the pounds dropping off, Even though you haven't made any changes to your diet or exercise routine, unexplained weight loss can be a key indicator of various forms of cancer, and prostate cancer is one of them. Cancer cells require a lot of energy to grow and multiply. They can disrupt your body's normal metabolic processes. This can lead to a range of systemic effects, including fatigue, changes in appetite, and sometimes nausea, all contributing to weight loss. It's important not to brush off sudden weight loss as a welcome surprise. It might be a sign that your body is fighting an internal battle. Seeking medical guidance is key to understanding the root cause of any significant and unexplained weight loss. Sign number 6. Pain or discomfort in the rectum. Are you experiencing discomfort or pain in the rectal area? If prostate cancer grows and spreads, it can sometimes affect the rectum due to its close proximity to the prostate gland. This can lead to symptoms like rectal pain, constipation, a persistent urge to have a bowel movement, urgency, or even incontinence. Other bowel changes like increased gas, a feeling of partial bowel blockage, or diarrhea could also occur. It's easy to dismiss these issues as something minor, but they shouldn't be ignored. A proper examination by a doctor, which might include tests like a digital rectal exam, ultrasound, or PSA, prostate-specific antigen, blood screenings, can help identify what's causing these symptoms. Sign number 7. Pain while sitting for extended periods. Does sitting for a long time make you feel uncomfortable, specifically with pain in the pelvic area? When the prostate gland is enlarged or inflamed, perhaps due to cancer, sitting down, especially on hard surfaces, can become quite painful. This pain, and sometimes numbness, often felt in the perineal region, the area between the scrotum and the anus, could be an indication of an issue with your prostate. If you find that sitting for normal periods causes you pelvic discomfort or worsens lower back pain, it's definitely time to consult with a healthcare provider to get it checked out. Now, it's also helpful to briefly understand what might increase your risk. Age is a primary factor. The risk of prostate cancer increases as men get older, becoming more common after 50. A family history is also significant. If a close family member like a father or brother had prostate cancer, your risk is about 2 to 3 times higher. Obesity has been linked to a higher likelihood of more aggressive prostate cancer, and ethnicity plays a role. For instance, African American men have a higher rate of developing the disease. While we don't know the exact cause of cells turning cancerous, a healthy lifestyle can contribute to overall well-being. This includes a diet rich in fruits, vegetables, and whole grains. Regular exercise, aiming for at least 3 days a week, is beneficial. Maintaining a healthy weight is also important. Always discuss your personal risk factors and any concerns with your doctor. They can provide the best guidance for your individual situation. So, those are 7 key early signs of prostate cancer to be aware of. Remember, recognizing these signs is the first step, and early detection dramatically increases the chances of successful treatment. Prostate cancer, especially when found early, is highly treatable. Please don't panic or assume the worst if you notice any of these symptoms. The most important thing is to take action and consult your doctor for proper evaluation. If you have experienced any of these signs or have concerns, please make an appointment to speak with your healthcare provider. It's always best to get checked. We hope you found this information valuable. If you did, please consider liking this video and subscribing for more health insights. Sharing this video with others, friends or family who might benefit from this knowledge can also make a difference. And as always, we encourage you to leave your thoughts, questions, or experiences in the comments below. Your engagement helps us all learn. Thank you for watching, and take care.